Assalamualaikum, very good day I be to all. I'm Dr. Ahmad Khairi Zazali, medical doctor from Hospital Putrajaya, Malaysia, and a master student in disaster risk management in Universiti Teknologi, Malaysia. Will be presenting a presentation entitled Review in Healthcare Worker Resilience from Managing COVID-19 Pandemic. As an introduction, healthcare workers play an important part in delivering the healthcare services to the society around the globe, and the workers' role become more crucial during disasters. Resilience against disasters in healthcare facilities is an important aspect in disaster risk preparedness and management in maintaining continuous healthcare services to the public. Pandemics and outbreaks are among the disaster hazards that potentially cause capacity strain towards the healthcare services based on previous experience of infectious diseases such as Ebola, severe acute respiratory syndrome coronavirus or SARS-CoV, H1N1 influenza A, and Middle Eastern respiratory syndrome coronavirus MERS-CoV, which emphasize on the importance of maintaining high level of resilience among healthcare workers. Recent upsurge of COVID-19 cases around the world has led to overstretch of healthcare workers' capacities, affecting the psychological well-being as well as continuity of work among healthcare workers in delivering the service. Thus, in defining the meaning of resilience, Zong had defined the term healthcare disaster resilience as the capability to absorb the disasters without loss of functions, maintain essential functions, and bounce back to pre-event state or to a new state of function. Why is the need for resilience? Resilience is an important aspect in achieving effective disaster risk management in managing biological disaster outbreaks. It is important for healthcare workers to be involved in the disaster risk management as suggested by the Sendai framework, strengthening disaster risk governance to manage disaster risk. A few papers have emphasized the need for effective disaster risk management in managing the outbreak. In this paper, it's acknowledged that high level of perceived efficacy of healthcare workers' role and high level of confidence, including from good education, training, and awareness, will lead to better willingness to respond during outbreak, as mentioned by Malaysia during the influenza pandemic in 2010. The effective social dynamics between healthcare workers, administrators, and public, as well as good public risk communication, are among the success factors in managing previous epidemic, as mentioned by Martinu during the Ebola epidemic, and Ataguba during the West Nile virus. The effective disaster risk management approaches, considered as less intrusive but highly effective intervention against COVID-19 spread, is concluded in a study by Hoeg in 2020. Baliser has emphasized on the need of good communication, adequate and proper training, good supply of PPE, vaccines, medications, and creating new norm of awareness and preparedness will increase likelihood of response willingness among the healthcare workers. And lastly, Chattumochai also concluded that availability of PPE will increase level of psychological communication and readiness between medical doctors and better level of confidence in managing patient care during the COVID-19 pandemic. Thus, recognition of resilience level among the healthcare workers is vital in achieving optimal disaster risk management towards the biological hazard disasters. A study concludes that half of Malaysian healthcare workers is experiencing burnout while managing the COVID-19 pandemic with factors such as direct involvement with the COVID-19 patients, pre-existing medical illness among healthcare workers, and poor psychological assistance contributes towards the burnout among these health employees. The degree of resilience will help healthcare managers to assess future psychological issues the workers may face, enabling them to offer behavioral therapy and psychology, job adaptation and relocation, as well as training and appropriate seminars to equip the workers accordingly. In discussing regarding the resilience among the healthcare workers, first I will discuss the framework suggested. Previously, the term hospital disaster preparedness and hospital disaster resilience are used interchangeably. Hospital disaster preparedness is outlined as actions executed by the hospital's administrators in designing, organizing, and implementing counteractive actions for effective coordination throughout the disaster response. The preparedness are divided into three categories, which are structural, non-structural, and functional preparedness. However, according to Zong, previous hospital preparedness studies are more focused on the administrative exercises but lack the concern for critical infrastructure security and services during emergencies, which are more relevant related in managing disaster events. Thus, the concept of hospital resilience will be preferred to understand about the hospital core capacity and aiding in incorporating the core capacity into a broader, complete view. The framework of hospital resilience has been developed to prepare a complete understanding regarding the hospital resilience, which includes the 4 indicators, which are robustness, resourcefulness, redundancy, and rapidity, as shown in this figure, which shows the framework on how the hospital resilience was based on these four factors, which build the coverage for vulnerability and safety, recovery and adaptation, continuity of essential medical service, and preparedness and resources in translating the hospital resilience definition. Blanchett has further described regarding the capacities in managing healthcare resilience, which are divided into four main dimensions, which are knowledge, uncertainties, interdependency, and legitimacy. These dimensions in resilience management will be practiced in three levels of resilience capacity, which are exaltive, adaptive, and transformative capacity. The flow in managing healthcare resilience is shown in this figure, defined by Blanchett as the capability of health systems to absorb, adapt, and transform when exposed to such shocks such as pandemic, natural disaster, or armed conflict, and still remain in same control of its structures and function. Psychological issues pertaining to managing outbreak are an important aspect and correlates directly with the level of resilience. Postdoc and everyone conclude that panic, anxiety, anger, depression, confusion, ambivalence, and marital retention are common negative psychological effects during the pandemic based on previous experience from SARS and Ebola outbreak. This is also supported by study conducted by Ware that COVID-19 pandemic may lead to anxiety, stress, and apprehension among healthcare workers managing positive patients. Two studies have shown that healthcare workers assigned to high-risk areas such as SARS wards, as mentioned by Wu, and MERS-related illness patients, as mentioned by Lee, are at higher risk to develop post-traumatic stress disorder or PTSD symptoms. Anxiety, insomnia, depression, distress, and indirect traumatization are among the psychological issues likely to develop among the healthcare workers actively taking care of positive COVID-19 patients, as mentioned in studies by Chatimochai and Wang. Furthermore, Wang has also discovered that Chinese healthcare workers had a higher risk of developing these psychological issues compared to the non-Chinese nationals healthcare workers. Hoffman has also described that stress level and fear of virus transmission to family members among the medical doctors are significant during the COVID-19 pandemic. A few studies have been done to address the resilience among the healthcare workers during the COVID-19 pandemic outbreak. Sharma and Sharma have found out in their study that resilience and preparedness against health emergencies were limited in among the healthcare workers due to insufficient training and adequate facilities and equipment to support the healthcare worker. Huang in the study discovered that the level of resilience among the radiological healthcare workers in Sichuan, China are generally low, with factors such as excessive identified stress, inadequate understanding and female gender, lacking of PPE, and poor targeted intervention by administrators are among the contributors to the lower resilience level. Postdoc and Ergun has also concluded that the level of psychological resilience increased with age and experience, and poor emotional support reduced the resilience level. Medical doctors are noted to have worse resilience level among the healthcare staff. This study also concluded that allowing good quality of sleep, good encouragement, and enhancing happiness towards life are essential in promoting resilience among the healthcare workers during COVID-19. Furthermore, active coping from depression, anxiety, adequate education and training, and active support from health administrators are the key factors that Lin concluded in reaching resilience among the healthcare workers working in unfamiliar place and conditions during deployment from other provinces in China to Wuhan province to help with the surging COVID-19 case. Wang in a study emphasized that having a high level of resilience in individuals may alleviate anxiety and exhaustion among healthcare workers, as well as maintaining good physical health among the healthcare workers. Hoffman concluded that the low level of stress, anxiety, sleep disturbance, and fatigue is associated with higher resilience level among the medical doctors, but interestingly discovered that generally healthcare workers' resilience level increased with increasing level of stress in 7 hospitals in the United States. Resilience and grit are protective measures in maintaining personal life and health and increased willingness of healthcare workers to be deployed to the frontline service. In conclusion, resilience level of healthcare workers is an important indicator in achieving optimum disaster risk management towards the biological hazard disasters. Thus, the level of resilience of healthcare workers will be a guide of the likelihood that the staff will develop psychological problems in the future when managing the healthcare patients during the COVID-19 pandemic, in which will allow the administrators to carefully assess the psychological problems that workers may face in the future. This intervention will allow managers to provide behavioral and psychological therapy, adjustment, job transitions, as well as adequate and suitable trainings and workshops to equip the healthcare workers appropriately. With that, I thank you.